All right, it's time to talk with our featured guest, Dr. Korinne Grieger. Corinne, how's it going?
Oh, great. Crazy morning. I forgot my curling iron, so got a little bit of a straight do going on.
Can you kick things off by telling us a bit about your business, your practice? Who are you serving, and what are some of the unique things you're doing for your patients?
My practice is sort of what I call myself a functionally driven cosmetic dentist. So my biggest thing that I do is more comprehensive and it relates to the bite and making sure that the bite is the first thing that I look at before I do any kind of restorative work or aesthetic work. So I use a lot of biometrics.
Mm,
Biometrics are things like the JVA, which is a joint vibration analysis that actually evaluates the jaw joint. That allows me to make sure that I'm prepared for any issues with the jaw joint when I'm starting to do Invisalign, or if I'm going to do like a full mouth rehab. I've got something called the T scan, which actually shows the actual pounds of pressure and the forces that are on each tooth in sort of a dynamic way, where I can see if there's any interferences or if there's like a tooth that's hitting heavier. And just in general, a lot of software that allows me to see things that I wouldn't have seen before I had gotten it. And this allows me to do more work and to help more people.
nice. So then how do you mention that to the patients in a way that they understand? How do you market it and advertise that?
Well, I do a lot of social media. I try to do these like little mini videos, and I basically will pick a particular thing that I'm interested in talking about. And then I'll explain what it does. And I'll show a video of what it looks like and why I use it in like about a minute and a half, 2 minute video on Instagram or Facebook, and showcase whatever cool little device that I have to help with whatever I need it for.
Nice. All right, Corinne. So then can you give us a peek behind the curtain and share what drives your passion for serving your specific patient base? Like how have patient needs or expectations you've seen evolved over time, and how has your practice adapted to that?
For me, I really want to be able to do work that lasts and that is successful. And so I find that the more information I have is what creates the success that I want to have. Originally, I really wanted to do surgery. I was excited about implants, and that was the first thing that I really was into fresh out of school. And that became limited, I would say. It's very
Mm,
specific. And I was never somebody who really was able to just do one thing. I liked to dabble in a lot of the specialty areas. For me, when you're trying to restore a whole mouth, you kind of have to have more knowledge than what you would learn in dental school to be able to treat patients in that way. Placing implants, doing sinus lifts, gingivectomies, or even crown lengthening to make sure that the gum lines are, in the right order. It all really just leads to that. But I will say that in 2020, when everything was happening, it scared the crap out of me. I was in survival mode.
mhm.
And that's my background, survival mode. Like I didn't really grow up with a lot of money. I was with a single mom with 4 children. College was never in my future. Actually, nobody even went to college really in my family. My drive and success has a lot to do with that. And so when 2020 hit, feeling that sense of, oh my gosh, where am I going? What's going to happen? I got scared. And I'm like, I need to be figuring out what I need to do financially, really, so that I can be able to take care of the patients in a whole and not have to send them out to specialists. Maybe I can kind of keep everything sorted myself, I guess you could say. But also, since I had dabbled in almost every aspect of dentistry, I really wanted to hone in on actually understanding everything and not just trying to figure it out. And
Mhm.
these biometrics and some of the courses that I started taking in 2020, I got hooked on this particular course that I've been taking for the last 4 years now. It's called CMS, which is Clinical Mastery Series. It's a great program because they just combine so many Coyce and Spears, some of the big league dentists that talk about full mouth rehab. So the speaker or the speakers will combine all that knowledge and make it into a very simple way to look at things. And biometrics was what they teach and what really just got me excited about. So that's, I guess, where I realized that if I have all this information, I'm able to do what I need to do so I can successfully take care of my patients. So it really
Mm.
was a fear factor. And then it led me to really getting excited about dentistry again, because I was at the point of a little bit where I was not as excited, not doing really what I guess I wanted to do, and not doing it where I felt confident. And so this gave me the confidence to be able to treat patients the way that I've always wanted to and to do it comprehensively.
So before that, were you not confident in treating patients or?
I think that I wasn't confident in treating the whole mouth as a whole. And I wouldn't even say that I didn't feel confident. There was failures. And I didn't like seeing failures, right? It did make me feel more insecure about what I was doing. And so I needed to feel more secure and more confident. And now that I have all this information and the knowledge, I just feel more confident and able to now feel like when somebody comes in, I can identify pretty much anything, whereas I couldn't really do that in the past. Like with the iTero, I've got a couple of those. That's been a huge game changer because I can see things that I never could have seen before. I had got it, I think in 2020, I purchased quite a bit of software and all this cool little gadgets that I can identify things.
Interesting. Okay. So then obviously, Korinne, we're still going to have like failures. So from that point to now, how have you handled failures differently?
I'm more able to explain why it happened because typically patients can easily blame it on the dentist, right? And I think in the past, maybe I didn't have as many big failures. Like now I'm doing full mouth rehab. So like if you have, 12 teeth, 10 teeth that you're working on and something happened and you got to like redo it, that's a big one. But there's been things in the past where we talk about one particular situation that bugs me. And I've learned this through some of the courses where you got one tooth that's hitting the heaviest. And then all of a sudden you do like a small filling or a crown and then it throws the whole bite off. And then the patient's like, my bite's different. And now I can't speak right. And I have all these, issues. The main thing I think that I've learned from it is that I'm giving them a heads up. Listen, this is what's happening. And if we don't fix your bite, put you in Invisalign or restore your bite, that this is going to be a forever problem. Because now that I've taken that first point of contact out and changed your bite, it's going to be another tooth now that you're hitting that's heavier. And now I've got to adjust that one. It's just like a big domino effect and it becomes a problem. And sometimes patients in the past had blamed me for that. And then I would just fix it versus now I'm like, this is why. And I can show them on the iTero. I can literally show them, hey, when you first came in, look, this big red spot, that's where you were hitting the heaviest. And that's why that tooth was a problem. And this is where we're at now. So I know how to fix it versus either having the patient upset or trying to think, oh my God, how am I going to do this? Right now, I know why and I know how to fix it. Or I can tell a patient ahead of time, listen, this is a complicated situation. When I mess with this tooth, there could be some issues and some complications. And you need to know that ahead of time. Really, you need to change your bite. We need to put you in Invisalign. And if they say no, then it's documented. And if something happens to it, then I am able to say, listen, we talked about this. We knew this was going to happen. Versus in the past, it was just, it happened. And then I didn't have much of an explanation about it.
I like that. So it's more like when they come to you and they're like, hey, this wasn't like this before I visited you. Now it is like this. What'd you do wrong, right? You're nipping that in the bud right from the beginning. You're like, this is the chain of events that's going to happen from this moment on. Interesting. And they appreciate that.
Well, I think I'm getting better at it because I'm seeing a little bit more now. I'm understanding more. I think maybe in the past, I wasn't necessarily comprehending that. I think that kind of always happens in dentistry, right? We do a crown and they had no pain, but the tooth was so broken down. There's cracks everywhere. It was banged up. I mean, obviously, it was a tooth that had a bunch of forces being put on it over 10, 20 years, but no problem with pain or discomfort because that's what happens. And then all of a sudden, you cut the tooth. You cause inflammation. So if there's already inflammation inside the tooth, and then now I'm adding more inflammation to it, it could lead to a root canal. So that's a little bit easier way to explain it, especially if I have to send you to an endodontist. They always go over that as well to help the patient understand. But I think when you just mess with one tooth and throwing the whole mouth off is a little bit more complicated and complex for the patient to understand. But when I am able to tell them this is really what you need to do before we start, because your bite is really bad and this tooth is really broken down. There's a reason why that's happening. And then I look at the scan and I say, you're really hitting heavy on this. Could be a first point of contact, meaning that as soon as I take that away, because I'm not going to make the crown or whatever I'm restoring on that tooth the same exact way because it's interfering. It's a heavy, forceful situation. So I want to remove that and remove the interferences. So when that happens, it can change the whole bite, you know? Yeah.
That's good. You mentioned that they say no and you document it. Why do you think they say no?
For Invisalign?
For Invisalign, yes.
Why do I think they say no? Oh, there's so many reasons. A lot of it is cost. Maybe it is that they don't understand. And that's what I need to try to get better at is really trying to focus on how to explain that in a better way. But like I said, all the stuff that I have, biometrics and the visuals that I have, I feel like I do a good job. But, not everybody's going to say yes to treatment, right? For whatever reason. Typically it's money, or a lot of times I just hear they're not going to wear it in the trays. It's too much of a responsibility and they don't want to have to deal with doing that. And that's fine. If you don't want to do it, I just want you to know the consequences. And I think that it's better to give them a heads up than to try to explain it afterwards, because people are not necessarily wanting to hear an excuse or an explanation afterwards because they're already kind of upset and frustrated and they usually just want it fixed. But sometimes they don't want to go into spending more money when they already feel like you've screwed up their mouth. Like, well, what are you going to do? Like, you just messed up my mouth and now you want to put Invisalign on me and you want to charge me all this money. There's a trust issue on that part. When you're doing anything, you give them the worst case scenario, because if that happens, then they're prepared. And when it doesn't happen, you're like the best dentist in the world because that didn't happen. Like, especially, you may be in a lot of discomfort. And then when they're not, they're like, oh, I didn't feel anything. It was awesome. All of the heads up and letting patients know ahead of time is crucial. So I've been able to have more of a heads up now when I am using these biometrics and using the visuals that I have versus 5, 6, 10 years ago, whatever, 16 years ago, I was not able to give them heads up on the more complex situations.
Yeah. So the bigger the heads up, the better, just in general, like that we can give them. Okay, nice. So then transitioning a little bit here, where are you located at right now, your practice?
I'm in Scottsdale, Arizona.
Okay, nice. Nice out there. So given your practice location and setup, what unique challenges or opportunities do you face compared to other types of practices? How do you leverage your setting to your advantage?
The statistics is about like 1,200 dentists in like my immediate area. I mean, there's a lot. There's quite a bit. But I definitely am different for sure. When I hire assistants or even front office, it's just not run the same way from the average dentist. I think that some of that has to do with the fact that I was an assistant for several years before I went to dental school. Actually, I wasn't geared to go to college. So at an older age, I got braces because I had really messed up teeth and I was teased a lot. And so I was going to the orthodontist. Finally, my family was able to afford to get braces, but I was like 16, 17 in high school where most of the kids already had their braces off. And I was going to the orthodontist and it was like an impressionable age. So I got interested in dentistry and that's where I led to doing it. But I worked as an assistant for about 7, 8 years as a dental assistant, mostly in orthodontics. But basically, when I hire assistants, I know they can do a lot more. I have them do a lot of the work in the back. Like I have 4 assistants versus most general dentists have maybe 1, 2 max. So I have my girls, I train them, I get them to do as much as they can possibly do so that I can be with another patient. We're very productive in that way. When they come to see me, they're like, I just know how to like hand instruments. And I'm like, no, you need to be able to use the biometrics, take impressions, even, some of the things that are not rocket science in dentistry. Hire somebody who's smart, which I usually do. These women that I'm hiring, very smart and they can figure these things out. And I obviously, make sure they're doing it correctly, but I try to give them autonomy and I try to have them help me out. And I think that most dentists, they do it all. They do their own temporary crowns, but the assistants that work for me are really getting the whole broad range of what they can do. And I think that empowers them. And I think that, again, that makes me more productive. So if I'm sitting there doing it temporary for 15, 20 minutes, there's so many other things, but I'm just making it simple. I could be seeing somebody else. I could be doing something else. I have a whole Invisalign line. It's about 3 columns. One of them is just Invisalign. So I have one girl who just takes care of the Invisalign cases. And I rarely even have to go into the room. She comes to me and says, this is where they're at. Either it needs another refinement or there's a space here, or we need to do this. And she tells me what needs to be done. I obviously check it. They know what they're doing. So there's not a lot of me sitting there in the chair with the patient doing clinical work as much as they are. That's what's different about the office. And everybody just works really well together. Huge customer service based. My practice is really geared around customer service because I feel like that's dead. Another thing that 2020 screwed up, especially when you go into a medical office and they're just like, next, we like make sure that the patients feel very welcome and that we are like almost like family. We know every one of them very well.
Okay, so then let's talk about that Invisalign schedule, right? The way you said you have 3 lines, right? And then they're Invisalign. One is specifically just for Invisalign, you said, right? How do you market for that? How do you have so many where you can just, boom, one Invisalign?
There's not a lot of marketing. I think Invisalign can refer me a few. I have been asked to speak for Invisalign. I will be doing lectures on training doctors or dentists how to identify things, because I'm really good at looking at an iTero scan and explaining to the patient, like, this right here is why this is happening. And it's very easy to see because it's right there and huge. And explaining the dynamic of the bite and why certain breakdown is happening, why that particular tooth is a problem, and then explaining to them why Invisalign is the best option to take care of everything. You got gum disease, that's probably because you're hitting really heavy. I'll see sometimes all these pockets on the left side. Why is that? Look at your bite. You're hitting really heavy on this side and you're not hitting anywhere on this side. So I'm almost every new patient, honestly, I will talk to them about Invisalign. And sadly, even people who just got out of braces a year and a half ago. And so that's a tough conversation. Even some of the best orthodontists aren't creating the bite that is going to be less traumatic for the patient. And then sometimes it's just a patient where I'm like, hey, you don't have much breakdown, but I know that your bite isn't where it should be. We'll do another snapshot in a couple of years and we can actually merge the two. What's great about this technology with iTero is that you can merge a scan you took in 2022 and then take another scan in 2024. And you can literally see any changes or movement in gum lines, if there's been recession or if there's been any chipping or wearing. And so if the patient's like, nah, I don't want to do Invisalign. Okay, well, we'll check in a couple of years. They come back in a couple of years and I show them literally, look, you chipped your tooth right here. Me, you didn't notice. I wouldn't have noticed. There's no way I would have even noticed that little chip. But when you look at before and after and you see that, then that's a motivating factor. So a lot of it is internal, right? It's like I have a lot of people in my office that I know need Invisalign. And a lot of times if I've spoken about it, then they break a tooth in the front. And I'm like I said, you're hitting heavy on your front teeth and that's causing wear and thinning out of your teeth. So yeah, you're going to be more likely to chip them. Now we can do a crown on your tooth, which isn't going to look great on one tooth. So now we got to do 2 or a veneer or whatever. But this all could have been avoided if we had just put your bite in the right position. And so then sometimes it starts even after they don't want to do it, just from a chip or a break on their tooth. And that is all just setting them up for talking about it and not necessarily, you need to have this. It's more like, this is the best way to have the healthiest mouth, right? And not everybody wants to invest in that. They're like, that's fine. I look fine. And usually it's not about aesthetics for me. It's about function. So I always make sure that they understand you have a beautiful smile already. It's not about that. Your canines aren't connecting right. And now you're putting a lot of lateral forces on your back teeth. And so there's wear on that. And so it's mostly internal. But that's what I'm trying to change right now, is I'm trying to work on doing my Invisalign cases a little bit faster, because that's been something I think that is Invisalign company itself. You have to know all the nuances on which teeth don't really move when it says it's going to move in the time. It will eventually, but let's do it a little bit faster. So trying to do internal marketing with thank you cards where we give them to patients, give them the opportunity to refer people, and then hoping that some of these Invisalign cases that I'm doing here internally are being talked about outside of the practice and then having people come to see me. So I'm not exactly where I would like to be when it comes to that, but I do have a vision and I'm hoping to get there in the next couple of years, maybe a year, to where people are seeking me out, calling me and saying, hey, I want you to do my Invisalign, not somebody down the street.
Yeah, you're becoming like a huge expert on this. So I have a question. I worked in a couple of practices where We've had an iTero machine. We've been trying to push Invisalign. I don't know what it is, Corinne. I don't know if it's just like the doctor's not motivated. Maybe they get motivated and then they stop, or maybe we're not all educated well enough or something, but it's once, twice a month. But then there'd be a morning huddle and we'd say, like, this is it. We're going to do it. We're going to do Invisalign as much as we can. And we're on like this high and then it kind of goes down. So is it just the courage to ask every patient?
Yeah, and identifying stuff, right? So literally it comes up almost every time somebody comes in and the crown pops off. There's a space that's left there. And oh, yeah, you just we need to fix your bite. You need a root canal. Oh, yeah, you've got a lot of root canals. And I see you have an implant too. Your bite's not right. It's always about the bite. All of the problems exist because the bite is not in the correct position. And most people don't have the bite in the right position. And I can identify that literally on the iTero and sometimes the T-scan based on the forces that are being extruded on the teeth and how long, because the T-scan is sort of a movie or a story of the bite, right? Just because we bite down, it's not always at the same time. There's sometimes like way more pounds of pressure on one tooth than the other. You'd want to eliminate that because that tooth eventually is going to be the tooth that either needs a root canal, either fractures and needs to be extracted, or needs some sort of restoration on it. So it's like, why not move that tooth out of the way and then fast forward 20 years, you don't have to deal with it. So I'm like just preventing all of these things from happening. And these are the conversations I have with everybody. Technically, everything that happens is because of forces, force related. Because even cavities are considered a source, because if you have a crown and you're getting a cavity around the crown, it's the crown breaking down, the forces, lateral forces extruded on the crown in a posterior molar. That alone could loosen up the margin, and that's where the cavity can start. Everything that happens in dentistry, I can say, you need Invisalign.
Yeah, interesting.
Or braces to straighten the bite.
Yeah, kind of looking at it from your lens, right? And then diagnosing that way, which is great. So, Len, when it comes to your team, you said you have 4, right, in the back office?
3. And then I have one girl who I don't know why she still considers herself an assistant, but she does my social media marketing and she helps to do stories on social media or Instagram. And she usually will come back if we are getting where we need help in the back. So she'll help with organizing, like, okay, where do I go next? And we're really good at not letting patients know. I mean, sometimes they'll say, oh, you're really busy, just because it's like loud and maybe I'm a little late, but I really try to stay on time and I don't make people wait because, again, that's a customer service thing. And I don't want anybody to have to do that. So if I am ever, I'm always just, oh, I apologize for making you wait, even if it's 10 minutes, I just kind of OCD about that. But, one assistant is over there talking to the patient and keeping them busy while I'm trying to take care of whatever I need to take care of in another room.
So then what qualities do you prioritize when hiring, and how do you maintain a strong team culture?
It took a while. That is one thing where I can say that the team that I have has been a long time making. It's probably the first time where everything feels very relaxed and comfortable, not a lot of drama, because, girls can be drama, especially when you have a group of them. And I'm not like that. I'm totally opposite. I'm more like a guy, but I also am a girl in some ways. I like to complain. And so we try to keep that low and try not to talk about negative stuff. We try to do inspirational quotes every morning. And then we usually do like some stupid, silly dental joke to set the mood. And I think when it comes to hiring, it's difficult right now. But everybody knows right now that hiring has been really tough. So finding really anybody who wants to work and then making sure that we're both happy based on pay and what I want them to do. So I try to find women I know that are really smart. I hate saying that, but it helps.
But then how do you know then, Corinne? Because everybody's going to say, like, I'm smart, I'm intelligent, right? They're not going to be like, I'm kind of dumb. How do you base it off?
That's actually a good question. I would say maybe they are more type A and more self-starters. And I know that doesn't necessarily mean you're smarter than the rest, but you can troubleshoot and you're a critical thinker. And I don't know if that's necessarily somebody who's actually smart versus dumb, but like more about critical thinking, being able to think on your feet and being able to, in a sense, help me out when it comes to, okay, I'm with a patient over here and then there's an emergency patient. They're asking the questions and trying to figure out what's happening. And then they come to me and say, okay, this is what's going on. I already have a treatment plan together. You just need to go in the room. And then I solidified that, like for instance, a great thing happened the other day where I'm in the room and I'm talking. This is the same situation where the patient has two teeth. And I told her, we really actually need to do crowns on these two teeth. It was 14 and 15. But when you look at them, 15 had hardly any tooth structure and it was caved in. Like it was just broken down. You can see the second layer of the tooth, no enamel on the cusp. But I was like, geez, that's tough, right? I'm going to do a crown. I'm not going to have a lot of height and it's probably going to pop off. And I'm going to have issues with this and you're going to have issues with it. So I originally said, let's do Invisalign so we can create some more room because I can create more room so we can do crowns on those teeth. And she was like, no, I snack too much. I'm not going to wear it. I don't want to do it. Like, okay, I thought I could convince her. So over time, I really wasn't able to convince her. She just came in and she's like, I'm having pain over here. I'm having discomfort over here. I'm like, okay, well, it's those two teeth we talked about 2022. And she even was like surprised that I remembered all this stuff. I'm like, I write all this stuff down and my assistants write amazing notes. That's number one. That's very important. Writing and dictating exactly what happened, because then in our morning huddle, we talk about that. Yeah, she came in at this time. We talked about Invisalign. She didn't want to do it. And now she's having pain on the left side. And we talked about these two crowns. And we didn't actually treatment plan it, but we just talked about it. So then she came in and I said, well, now we got to do these crowns. But then my assistant started saying, well, maybe we need to do crown lengthening on 15 as well. And I'm like, oh, yeah, we need to do crown lengthening too. It's an added expense for the patient, but that's what she needs. And also, hey, you should have done Invisalign kind of thing. I still couldn't convince her to do Invisalign after that. But I'm like, okay, two crowns, crown lengthening, no insurance. That's a pretty big out-of-pocket expense. Almost the same price as the Invisalign, to be honest. And I'm like, now you're still in the same position. We still don't have a lot of tooth structure, and I have to adjust the opposing tooth a lot. And now we're just in the same situation because those are the two teeth that are bugging you now. But then where's the next part is going to start breaking down? So I'll fix that area. And now it won't be like so much interference and you won't have heavy forces on it. But where's the forces going now? It's hard to equalize the force when you can't move the teeth and put them in the right position. So
yeah. Do you tell the patient that or no? And then they still are like, nah.
Yeah. This lady's, I love her. She's great, but she just is like, no, I'm not going to do it. I snack too much. You can't really convince somebody who's not wanting to do it. I'm like, okay, so when you have a problem, I'll fix it. And that's what most dentists do, right? You have a problem, I'll fix it. But I'm like, yeah, I'll fix it, but let's not maybe have that problem. You know?
No, that's really good. So then can you share, because you said it's taken you a while to get this wonderful team. So can you share a time when hiring the wrong person taught you an important lesson?
In the beginning, I would say I hired a lot of wrong people. And that's because I was doing it.
Really?
And I thought I was doing it right. I think I got a little close with them, or I would get on the phone with them and they would fall in love with me and I would fall in love with them. And it was more like not as business-like as it should have been, right? And then they come in and the expectations weren't really there and it just didn't work out. So I did a terrible job. Then I hired one of my office managers who I had recently, who has left since, but she did a really great job. And I think that she was the one that helped me find most of them. I think that she sets guidelines, and doesn't act like she's excited. I mean, I was always excited. Oh, I can't wait for you to start. And I'm super excited. And she just was like, we'll see how you do. Just more business-like and less friendly-like and family-like, because I know that that can be a problem too. That's one of the things that I struggle with is my team is like family and I love them all so much. We do talk about personal things and things outside of what we're doing. And I know that HR-wise, that's not the best way to run a business because that can create somewhat of a, I don't want to say hostile environment, but sometimes because we sometimes hurt the ones that we love the most, right? Like our family, like say things that are inappropriate to our family and we don't speak to them maybe in the best way. And so sometimes that can ingrained into the practice as well, because we're with each other for so long. I mean, we're with each other sometimes more than our families at home. I'd say that's something that I need to work on, but it is hard because I'm not just so business-like like that. I care about people and I love people. And so in a sense, when she started doing it, that's when it all changed. I think we got better employees because of that. Now, how she did it, I can't really tell you exactly, but I know that some of the things were the fact that she was just like, we'll see how it goes. And she's just very business-like in nature. We usually used Indeed, or I think we did Craigslist long ago. I don't know if that's even a thing anymore, but we would try to put an ad, because this is what I noticed she did, because my ads weren't the same. Something that stood out. like funny or quirky, where when you read it, it's like, oh, that sounds like an interesting office. It's different. And then not feeling so rushed to hire somebody. In the past, I was always like, oh my God, I need somebody. I need somebody now, like, because somebody left because they probably hired them wrong. And then I'm like, I don't have anybody. I need to hire somebody right away. Can you start tomorrow? That urgency, it sounds like you're trying too hard. Whereas now we're like, yeah, let's take our time. We're not going to act like we're desperate. And then seeing how it goes, even if we don't have somebody. I mean, technically, I have so many people here that when somebody is gone, it's not the end of the world. Versus when I first started out, I only had a couple assistants and one first person in the front. So when one person was gone, it really threw a lot of things off with the way that I'm constantly wanting to be working in operatories nonstop. So now I'm able to, have the ability to take my time to find somebody. And so that would be another really important thing, is making sure you're not too urgent with the hire. You take your time, you do a working interview, you give that 90 days, you make sure they know, hey, we're still testing it out. Not, oh, I'm so excited you're starting on your first day. I can't wait to have you here for 20 years. That didn't work. So
Interesting. I like that. I like that a lot, especially finding that balance between like friend, family, kind of like Michael Scott, right? In The Office. I don't know if you watched that, but he always thought it was his family. But you got to find that balance, I feel, too, because it is hard.
It is hard. I don't know if I found the balance yet, but I'm definitely trying to figure it out. It is hard.
Gotcha. Okay. So then real quick, Corinne, how many new patients are you getting a month right now?
Actually, 20 is on average.
Okay. And your marketing is specifically just social media or?
Yeah. And then handing out thank you cards. We're kind of in the process of figuring out where we want to go from there. We thought about some flyers. I heard that some people think it doesn't work, but then I hear other people say it does. So we're going to probably try that here. But I have a friend that is on the radio that I've done some radio time. Really, yeah, just marketing on social media. I think that's been my biggest thing. And I don't know that it's necessarily working. I think the Google reviews has been a big selling point for me. I think probably more than 50% of patients who come to see me always say they chose me because of my reviews, because I'm just heartbroken when I get a bad review, and we've all had them. I think that helps too, when somebody is looking for their insurance and they're looking through dentists and choosing who they want. They go on websites and they see who has the best reviews, right? And that's what people do. I feel like that might be one of the biggest things. And I do take still some insurances. So a lot of people are referred through that. But as far as marketing goes, we're adding some things here and there, like new patients. We just started putting a little bag together with a water bottle and chapstick and like the thank you cards in it. It's like a nice little welcome bag, really pretty Tiffany blue kind of like bag that is like, thanks for coming in, and then giving them a tour. I mean, it's different in that way too. Like I said, customer base, we give them a tour of the office, explain everything, introduce people, and then we sit them down with their new gift, and it creates a really good experience so that hopefully they will tell their friends to come and see them because they have the referral cards. So we're thinking that's really the best marketing tool. I feel like some of the other things I've done, I don't know that I've gotten a lot of big return on. So we're sticking with that. And I think we're going to maybe do the mailers at some point. We just have to put that together.
Okay, nice. So then, Corinne, one of the last questions I wanted to ask you is, from the moment you decided to do this, your own business, your own practice, till today, what's been some of your biggest pitfalls or failures that you've experienced?
Oh, that's tough. I mean, my name is Dr. G. I am a baller. Just kidding. I guess it's probably just a lot of little ones. I'm kind of an overachiever, sort of a gunner, workhorse. So I think that when there has been pitfalls, I try to troubleshoot, figure out how to get out of it. I think that one thing would be sleep dentistry. It's so difficult to be as successful in that area as I have been in other areas. Like when I decide I want to do something and get successful in it or get educated on it, sleep dentistry, I think I tried to do almost 15 years ago. I was trying to do it, but then there was medical insurance involved, right? So the medical aspect of it has been kind of the annoying thing that stopped me from doing more than I'd like to be doing. But I still do. We do oral appliances, we do sleep tests, but I don't take medical insurance. So, I want patients to be able to use their medical insurance. So it's hard in that area. So I haven't quite figured out how to tackle that. And maybe some of the hiring I had in the past, but nothing necessarily really big, I hate to say.
No, that's good.
Yeah.
I think that's good though. So then the sleep kind of hard to implement right now for you.
Yeah, sort of, I guess, but it is implemented finally now. But I
Hmm.
mean, it took me several tries. Like the first time I did it, I failed because I think I wasn't talking about it enough, or the team didn't really understand it. And then the company I was using, it was very new, right? This was early on. And there was medical insurance involved. I asked the office manager at the time, because when you work with medical insurance and you have somebody that's doing all that paperwork, there needs to be some sort of fee on their part. So I told my office manager, hey, you can figure this out. I'll give you a certain percentage, right? I think it was like 12%. Whatever we collect, you can have that just for doing all the medical crap. So I never hired a company. Maybe that was my biggest problem, right? I didn't use a company. I was trying to use internally my office manager to make more money, and
Mm.
also to train him on how we can do it here. And then that didn't work out. I thought he was going to be interested in making 12% more on anything that we collected. So then, about 2 years later, my brother actually went to learn how to do medical coding. And so
Oh.
I was like, oh, awesome. I'll hire my brother to come and work with me. That didn't work out so well, but he got me connected with some of the insurance companies. I got enrolled or signed up with them. And then that didn't work out. It just never really got to the point where we moved forward on that. Because again, I thought he would be able to do it. So now I'm over here thinking, gosh, medical is so difficult and so time consuming,
Mhm.
really just annoying. Then I think just recently, in the last 3 years, with the company that I've been training under, Clinical Mastery Series, they kind of almost said, hey, you can use medical or not. If you see something and somebody needs an oral appliance, you can just not deal with that. Or you can
Mhm.
have this company go through all this medical stuff. And I think that with all the other stuff that I was incorporating, I just didn't want to take the time to do it. So I think that is definitely something that I will be focusing on in the next couple of years. But there's been failures definitely with that one. And it's been kind of the most annoying thing for me, because when I do set my mind to something and I do want to incorporate something, it gets incorporated and it continues to become better
Yeah.
versus it just, okay, fell. Okay, I'll try again. I literally said this last time, the third time, if this doesn't work and I'm not doing what I need to do with sleep tests and oral appliances, I'm literally giving up. So thankfully that didn't happen. It's just not as profitable, I guess, and as busy as I thought, or as I would like it to be. Not necessarily what I thought it would be, but what I would have liked it to be.
No, yeah, yeah, yeah. Sometimes, Corinne, slow is the fastest way to get there. And so just take it the way you're taking it right now. So,
Yeah.
I mean, your team's going to know about it. You already know about it. And it's going to continue to grow, right? Sometimes the demographic too needs to know about
Yeah.
it a little bit more.
What I think is really cool about the whole sleep thing is that I've been talking about it now for a long time, but really having like the hygienist like come in. Oh yeah, we check the Malampati, which is a score to see the
Mhm.
airway, and then that's like a sign. We look at other things, medical history, male, female, things like that, weight even. But it's really cool when the patient comes back 6 months later, even though they're not interested in taking my sleep test or interested in everything I have to say. Like, yeah, I went to go to my doctor and now I'm on a CPAP. And I'm like, that just makes me so happy, because it's like,
Mhm.
I am saving lives. Dentists usually can't say that. So it's really cool to feel like you're actually helping somebody, and they're appreciative too. Because medical doctors certainly aren't saying anything. Oh, you have high blood pressure? Here's a pill. Not, maybe we should look at your sleeping. Are you sleeping well? I mean, it just doesn't happen. So I think
Mhm.
that's changing, but dentists right now are the ones that have to be kind of responsible for that. I think we all should be looking at that, especially in the next 10 years. I think it's going to be a standard of care, really. So I think
Mhm.
all dentists should be looking at sleep and having that conversation.
Yeah. No, 100%. Yeah. And so, last question, it's time travel. This is so our audience can get to know you. If you could go back in time and give your starting out self one piece of advice, but it cannot be business related, what would it be?
I realized probably in dental school that I didn't speak to people the way that I feel like I should have spoken to people.
Hmm.
Like I said, I am kind of a gunner and workaholic, maybe a little bit, but I always assumed everybody else was like me, right? Like, just get it done. But how do you not understand that? What are you not getting? Sometimes I would speak in a very, I guess, inappropriate way to people. I think I did that with friends. And also, when I started practicing early on, I did have a lot of issues with how I spoke to some of the assistants, especially when I was an associate. I mean, I wasn't paying their paycheck. who am I? And who's this girl who's just coming in and telling us what to do and telling us that we're not doing it right? And the way that I was explaining it to them, because I'm a lot better now, a lot better. I wish I had known how to speak to people, not patients, because I was always good at that, but my colleagues and people that I worked with, and making sure that I understand that there's different personalities, there's different ways that people think, and certain ways that people go about the way that they think about things. And so I kind of always just was more military like, when I would speak, you got to give a little bit more compassion and you got to be a little bit more patient. I've had a lot more patience. So maybe that's the thing, is patience, and to try to understand the other person's perspective versus just me in my own little bubble and what I think everybody should be, and how if they spoke to me like that, I would be fine. But most people wouldn't be. It's really just how I talk to people that I worked with, or just people where I was doing anything, even in sports, just to make it like non-business related. It started out when I was playing sports or dancing. I was on a dance line in high school, and I got really frustrated with some of the girls that like were not doing it right. And I would probably say it in a mean way. To them, it was mean. I guess there's the way that you could say it better. And so I'm a lot better at thinking of what I'm going to say before I say it. I can go on and on about that. I'm ADHD. So, you sometimes when you're younger, you don't realize that you're just spurting out stuff without thinking. And so now it's like I really have to think about what I'm saying and take the time and understand who I'm speaking to and make sure that I have patience and that I'm kind and all that good stuff. So, yes.
No, I love that. Yeah. So you don't want to sugarcoat it, but you want to season it with salt still. You want to be able to have empathy and patience when you're talking to someone.
Yeah.
Love it. Yeah, no, perfect. Korinne, thank you so much for being with us. It's been a pleasure. But before we say goodbye, can you tell our listeners where they can find you?
Yeah, we are in Scottsdale, Arizona, on Shea and Hayden. It's 10601 North Hayden Road, Suite I-101 in Scottsdale, 85260. And it's Core Smiles with a K, Kor Smiles. It's the first three letters of my name, Korinne. That's how I thought of it. So you can check us out on Instagram, Facebook. We've got a YouTube channel and also TikTok. We were off of TikTok for a little bit, but I think we're back on. I do little mini videos, so you can check me out there.
Nice. Awesome. So that's going to be in the show notes below. And Korinne, thank you so much for being with us. It's been a pleasure, and we'll hear from you soon.
Okay. Thank you.